The health system in Sudan, unfortunately, totally collapsed. More than 80% of the services that was actually located in Khartoum state are right now out of service. Even those are the remaining 20%, unfortunately, have been uh, continuously harassed from the different artillery that have been unfortunately shot directly to those hospitals and healthcare workers, including, by the way, the conflict that or the atrocity that you highlighted in Darfur, which has like some sort of genocide related and ethnic cleansing. Unfortunately, people were killing inside hospitals, bodies thrown out of the streets. There is no basic infrastructure that could secure safe water, that could secure, full availability for the people whom have been affected. Unfortunately, also after more than 8 months of this conflict, we started to see post-traumatic stress disorders. People are started to realize that this unfortunate fighting between the two generals is not gonna end soon, and unfortunately they don't have the will, to cease fire and to look at their people.
Doctor, if you can briefly tell us what you are doing. I know in the past you've supported the only pediatric hospital remaining in Sudan. What kind of support is SAPA giving the doctors there, the medical facilities in terms of medicine, equipment? And as the weather pattern changes, what is the most important thing that needs to be done to prevent diseases from spreading?
Right now, SEPA is doing the best possible to mobilize resources from Sudanese doctors whom are able to support the people of Sudan, where we have like some sort of secured humanitarian corridors. So we are working right now in six safe states where it has like the huge amount of internally displaced people. We are trying the best possible to provide services that could support the availing quality health services for the people whom has been displaced, especially where we have like some sort of momentum for healthcare services, specifically in Jazeera State, Northern State, Red Sea State, and White Nile. We were working on the Darfur states, but unfortunately, due to the different nonsense attacks on civilians and hospitals, our services has been disrupted in South Darfur, uh, and unfortunately we lost, people who were directly contact. We were having like some sort of support for them, especially, our healthcare workers lost their beloved ones in Nile, which has affected directly the service availability on those locations. So I really, I
Right,
feel
doctor.
like I'm sort of ashamed of the situation of the healthcare services in Sudan because of the different disruption
Thank you,
that
doctor.
health workers have faced.